So, just real quick, a bone spur.
Right.
I'm good. There, you can have bone spurs anywhere you got a bone.
Right.
But they're really kind of painful, like in the spine and in the neck. And do you ever remove those?
Often. For example, a bone spur can be caused by two things. I'll give the first example with an analogy. If you sand a block of wood with sandpaper and you look at the edge of the block of wood, you'll see sawdust, right? Mm-hmm. So if you have two bones that are rubbing against each other, it generates cartilage, living cartilage, and living bone dust. And they pool in the outside of the bone, just like the sawdust collects out on the side of the wooden block that you're sanding. The difference is that wood is dead and the bone is living, and then it heals just like fractured bone would heal, and you see it as a bone spur on the edges of joints. And so it's really the living residue of the grind.
Wow.
And when you do a joint replacement, often the joint that you see, like I did 2 knuckle replacements today, actually 1 middle joint and 1 knuckle joint on 2 different people. The cartilage is scraped clean, the bone is shiny because it's polished like you'd polish anything, and off to the sides are huge spurs, which are really the collections of bone dust that have consolidated into a spur. And they're often very painful. But what really is the source of pain is the lack of cartilage, which is the padding at the end of the joint, right? Once you wear that padding away, it's gone. And then in closing, the last form of bone spur is where a ligament, like a heel spur, for example, where the tendon just pulls and pulls and pulls and pulls on the bone, and it micro tears. And as the tendon tries to reattach itself, God's pretty smart. He says, I'm going to heal this with the strongest tissue known. I'm going to turn it to bone. And so when you look at a bone spur on an x-ray, you're really looking at the once tendon attachment to the bone that's now turned into bone to stop you from ripping it. And so it's not the bone spur that hurts, it's the irritated fascia, the plantar fascia that's pulling on that bone spur. It's really plantar fasciitis, not a bone spur, not a heel spur. So there's no such thing as a painful heel spur. It's plantar fasciitis.